This taping technique is for an Achilles tendon injury. First, you will apply 2 heel pads, one on the back right above the heel on the Achilles tendon, and one will be in the mid area of your ankle. Then you will apply pre-wrap from the mid-calf all the way down to the mid-foot. You will attempt to cover the heel pads in a clean and precise manner without folding the heel pads in any way. Make sure you cover all aspects of the heel and the tendon, Achilles tendon. Once you finish the pre-wrap, you will place, depending on the size of the calf, 2 to 3 anchors using the 2-inch tape. And you want to make sure the patient is plantar flexing to provide a flexed calf to allow for limited movement. You will then apply another anchor at the ball of the foot. You will want to apply more than one. In this video, I have applied 2 anchor strips. You will then grab the heavyweight elastic tape. Before cutting the tape, you will want to measure the perfect amount, which will be from the anchor at the midfoot to the anchor strips at the calf. Before that, you will want to ask the patient where their pain is specifically at the Achilles tendon, and will want to make sure to keep that in mind for a later step. You will measure how long you need a heavyweight elastic tape. You will measure it and then cut the piece of heavyweight elastic tape. You will then grab one end of the heavyweight elastic tape and firmly place it on the midfoot anchor, and make sure it is firmly placed on the anchor. And you will place the other end at the strips at the mid-calf. Make sure both ends are firmly pressed. You will then grab the heavyweight elastic tape again. However, this time you'll want to measure it a little bit longer than the first one. You will then cut the measured heavyweight elastic tape. And then you will want to make a small incision down the middle of the strip. Then you will place one end of the heavyweight elastic tape at the midfoot anchor. Make sure it is firmly placed on the strip. And then you will then tear down the middle, the heavyweight elastic tape, to where the tear will be right over the pain spot of the patient. You will then grab both ends of the tape, and you will perform an X pattern going from the left side to the right side and right side to the left side. Now you have to make sure that they are both placed on the white strip anchor at the mid-calf. And then you will finally want to use a 2-inch white tape to close all the way from the mid-calf down to where the V-shaped strip from the heavyweight elastic tape is formed. And you want to make sure you don't go over the Achilles tendon or where the pain is. So as you can see, I stopped right where the V shape starts to form. And then you'll also want to close at the midfoot where you place your heavyweight elastic tape. And you make sure you want to close from the bottom of the foot to the top, leaving no strips on the bottom. And that is how you perform an Achilles tape. This taping technique is called a closed basket weave with heel locks and a subtalar spring. First, you will place 2 heel pads, one right above the heel on the Achilles tendon, and one on which we call the talocrural joint, which is on the midline of the ankle. Now you will apply layers of pre-wrap. You will want to start over the heel pads to secure them down, and will want to make sure that you go over the heel correctly up to the midfoot. And we'll also want the pre-wrap to go all the way up to right below the belly of the calf. Next, you will take your 2-inch white tape and place 2 to 3 anchors at the base of the calf. Then you will want to place 1 to 2 midfoot anchors at or below base of the 5th metatarsal. Now that you have your 2 anchors, you will now perform 3 stirrups pulling medial to lateral and 3 horseshoes pulling medial to lateral as well. You will want the stirrups to start on the anchor at the belly of the calf and go around the heel to the lateral side of the ankle, and you will alternate between the stirrups and the horseshoes. You will also want to make sure that your horseshoes begin on the anchor at the midfoot, go down below the ankle, below the calcaneus, and up on the lateral side of the anchor strip, and you will continue to alternate between the stirrup and the horseshoe. You also want to make sure that the patient is constantly dorsiflexing or pointing their feet upwards so that it provides tension and correct placement of tape to allow for limited movement of the ankle. You will want to make sure that your stirrups are not all overlapping. You would want one going either from bottom to top or top to bottom, having them fanning out. Now, for the subtalar sling, you will be using power flex. You will begin on the first, right below the first toe. You will be coming around the ankle to the back of the calcaneus, above the foot, and you will want it to end on the anchor at the midfoot. You will then perform the opposite side. You will start at the bottom of the 5th toe. You will come across, down the calcaneus, and you will want to, again, end on the midfoot of the anchor at the midfoot. Now that you have placed your 2 subtalar slings, you will want to close from the top anchor all the way down to the midfoot. This is to ensure that all the stirrups and horseshoes are all covered and leaving no room for any loose tape. Now we will perform 1 figure 8. You will start at the top of the midfoot. You will come around the bottom of the foot, up and around, down behind the Achilles tendon, and will come all the way up back at the top of the midfoot anchor. Now we will perform 2 heel locks, 1 medial, 1 lateral, and repeat that twice. To do these, you start at the top of the foot. You will come down around the ankle, across the calcaneus on the bottom of the foot, and finish up across on the top of the midfoot anchor. You will be performing 4 heel locks, 1 medial, 1 lateral. However, you will repeat these twice in a pattern of medial to lateral. Now, you will want to close the foot and lower leg once again to cover ends of the tape. You want to make sure by the time you're done, you have a triangular pattern on each side of the closed basket weave, which ensures you performed your tape correctly. This taping technique is called an X-arch. First, you want to place your 2-inch tape anchor directly on the skin over the base of the metatarsal heads, right under the toes. You will make sure you want to end your strip on the top of the foot. Now, you will place your 1.5 inch tape starting at the bottom of the 5th toe, and you will want to come around the medial heel, up across, forming an X, ending on the anchor strip right below the big toe. Then you will start under the big toe. You will come across outside the heel, come back in around the heel, and finish under the 5th toe on the anchor strip. Now, you will perform this until you come more inside of the foot and the tape begins to overlap one another. You will once again start at the 5th toe on the anchor strip, come around the inside of the heel, around the heel, coming up across, ending under the big toe. Hence, making a form of an X shape over and over again. Now that you have finished your X taping, you will want to cover the strips on the anchor and on the ball of the foot. So once again, you will start from under the foot. You will come around laterally from the outside of the foot, pushing in and closing on top. You will want to perform multiple closures to ensure the tape is put in place. But you do not want to tape around the heel on the bottom. So as you can see, I can bring the tape. I place it on the bottom of the foot. I come around the foot on both ends and finish the tape on top. As you can see, I have closed the anchor strip on the top to ensure they are put in place, and I have sustained the arc of the patient. This taping technique is called a thumb spica. First, you will want to take your pre-wrap and place a little hole in the pre-wrap and place it right over the thumb to ease the pain. You will then layer the pre-wrap around the wrist, up into the forearm where it fans out to the upper forearm, around the palm, below the digits, however, and we'll want to create a precise and clean pre-wrap. Next, you will want to take your 2-inch tape, and you will want to make sure the patient is firmly placing their hand into your stomach to allow the patient not to move when placing the firm anchors. You will want to place the anchor starting from the top of the pre-wrap down to the wrist. You will also want another anchor around the middle of the hand on the palm. You will also make sure you don't want to rip your tape on the palmar aspect of the hand. Make sure it finishes on the top of the hand. Now you will get your 1.5-inch tape. Now you will want to ask your patient where their thumb hurts, and then more specifically, you want to place them in a pain-free position. Now you want to take your 1.5-inch tape, stretch it out, anchor a little bit of it, pinch it, and you will want to come from behind the thumb, and you want to make sure you come over the knuckle of the thumb and make an X, kind of cross over the two ends of the tape. As you can see, I pinched it one more time. I came behind the thumb, come over the knuckle of the thumb, and I want to overlap them in an X-like manner. Make sure they are ending firmly on the circular tape on the forearm and wrist. You'll want to place 3. Have them cover all over the knuckle of the thumb in an X-like manner, all ending on the strip. Throughout this video, you want to keep checking the capillary refill of the thumb. Now you will place 3 C-like stirrups starting from the top of the hand, coming over across the knuckle of the thumb, ending on the strip on the palmar side of the hand. You will also want to place 3 of these C-shaped stirrups, all starting on the dorsal aspect of the hand, on the top of the hand, ending on the strip on the palmar side of the hand. Make sure they are all overlapping over the knuckle of the thumb. Now you will want to perform a figure 8 closing. You will start on the top of the hand, come around the wrist, over the hand, around the thumb, down under the palm of the hand, and come across over the top of the wrist. Now that you've closed the C-strips on the bottom, you will want to close once again. Once again, you want to check the capillary refills to make sure of tightness of the wrap. In this video, we will be applying a horseshoe pad to an injured lateral malleolus of a patient while applying an ankle wrap. You will instruct the patient to hold the horseshoe pad on the injured side of the ankle, and you will start applying the ACE wrap. When applying the ACE wrap, you want to make sure you firmly press around the horseshoe pad to apply pressure to the injured ankle and keep it in place. While applying the wrap, you want to wrap in a manner where you come all the way up, come around the foot, the leg, and come all the way down. This helps you perform the wrap in a manner where it shapes a V or X-like manner. This helps with constant compression on both the lateral and medial side of the foot. Once you have finished the wrap, you will also instruct the patient to hold the end for you, and you will want to close the wrap with your 2-inch tape to secure the wrap in place. You will want to perform around 2 to 3 closings on top just to hold the ending of the wrap in place. And as you can see, this is the manner I was talking about. To create a donut pad, you will take your pad of your choice and fold it in half and create a small incision down the middle. You will then open it up, and as you can see, the small slit in the middle, and then you will attempt to create a small circle just for the size of a blister on a foot. Now you will slowly want to make the pad smaller and smaller and form it into a donut-like circular shape. You want to curve the edges and make it as smooth and circular as possible, looking just like a donut. Now that you have created your donut pad, you will slowly take off the adhesive cover, find the location of the blister, and in this case it was on the heel of the patient, and you will place it firmly on the location of the blister. Now, in this case you can use Power Flex, a type of tape, and you will firmly and precisely cover and close around the location of the donut pad and the heel. You will want to make sure that the patient is comfortable while walking around with the donut pad and the type of tape you prefer to use, which is why I use the Power Flex. I believe the patient will be comfortable while walking, and the donut pad is firmly placed onto the heel and has no room for any movement or dislocation of the donut pad. And then over the Power Flex, if you choose to, like in this video, I closed with regular 2-inch tape just to ensure that the Power Flex is not taken off.